Coming up next, you'll have an opportunity to hear from two experienced plastic surgery nurses who are legal nurse consultants, Kenna and Grace Flack, who are my guests on Legal Nurse Podcast. We took a look into what goes on behind the walls of the operating room and how some of those events can result in liability issues for plastic surgery staff. What were some of the topics that we covered? Tell our listener what they can expect to hear about during your show.
Yeah, so we talked about the expected complications after plastic surgery, and sometimes those can be, people don't expect the complications. So it's really important to know what is normal and what is not. And we also talked about how a nurse might actually become a defendant in a plastic surgery case. And that's when, the surgeon wants to do one thing, but the nurse knows that it's not right. So it's really up to her to voice her concerns and document everything.
Yeah. And we also touched on just knowing when to look at final results of a procedure. If a patient's not happy with the outcome of their procedure, when kind of the timeline as to when they could move into the legal aspect of it, just knowing what the outcomes are and when they're final, actually considered final. And then we also touched on an important subject with huge legal implications, just safety as far as fire risks in the OR, because that is such an important subject and can be truly life-altering for patients, and it can be devastating financially and legally to everyone involved.
Thank you, Grace and Kenna, for sharing your knowledge, and you'll have an opportunity to find out a lot more about this topic when you watch their podcast on plastic surgery. See you then.